We use communication skills a lot and de-escalation skills. It's really important to be able to, first of all, be able to be aware of what's happening around you at all times. And not only with your patients, but with your coworkers too, because you got to kind of watch out for them as well, because you never know what's going to happen. Being able to look at a situation, recognize something's going to happen, and then take the proper steps to keep things in control, and not in an authoritative way, but more with just like approaching the patient with your physical demeanor, hands it kind of out, hey, what's going on? Kind of almost, putting into their court, no hands in your pockets, listening to what they have to say. Listening is like the number one tool I feel like I use. Just listening and then reflecting back to them what they say and giving them that validation that you heard them. And don't make promises. Promises are not a good idea. But listening, and then if you can't de-escalate them, you can't talk them down, calling in for maybe security. We have some great security liaisons that come in, and they're not dressed up like security, and they're really good at talking to people too, and sometimes they can bring them down. And then if they can't, just being prepared and ready to know that you might have to go to a situation to protect yourself, your coworkers, and especially the other patients. If someone loses control and can't control themselves, can't be de-escalated. And at that, in those times, you just need to be ready for an IM injection, some sort of medication to help sedate them, to keep them safe and others safe.